A very good afternoon, everyone. My name is Punit Mishra, and I'll be sharing a few key findings from a study that we at Piramal Foundation conducted to assess the ILA trainings, its quality, and the resultant effect on knowledge, skill, and practice of Anganwadi workers. We conducted this study under the mentorship of Niti Aayog in 11 aspirational districts. I'm sure the people who are attending this session already know about ILA, but to set a context, I'll give a very short, brief background of ILA trainings. These trainings were designed on the principle of learning by doing under POSHAN Abhiyan to train the frontline health workers, Anganwadi workers. There are 21 modules which covers a range of issues, and these training was rolled out across the country in a cascade mode soon after the launch of Poshan Abhiyan. The foundation conducted this assessment to observe the trainings on ground, to understand the challenges, and to provide possible recommendation to improve the implementation and the outcome of these trainings. As far as the design of the assessment was concerned, it was a mixed method approach with the three major components: observation of ongoing ILA training, in-depth interviews with key stakeholders, and a quantitative survey with the Anganwadi workers to assess their knowledge, skill, and practice. We observed around 19 19 trainings during these 2 months, December and January 2019-20. We interviewed around 154 stakeholders across state, district, block, and sector level. In ILA training, there are state resource group, district resource group, and block resource group. We actually interviewed members from these resource groups for these levels. We interviewed 264 Anganwadi workers across 11 districts. The approach was a two-stage sampling where we selected 12 blocks, 12 Anganwadi workers from two blocks in each of 11 districts. These are the names of those aspirational districts where we conducted these interviews. Uh, Post observing and speaking with the key stakeholders, we bucketize the concerns and the issues related to quality of trainings, and these issues are mainly related to compliance with guidelines. We observe poor quality of training, especially at the sector level. At the sector level trainings, two or more than two modules are generally clubbed for one session with significant batch size. It's huge sometimes. That makes difficult to fully dedicate a definite time to each module and make the trainings interactive and effective, which was there in the design to make the sessions more and more interactive and communication based. As far as the quality and approach of the trainer is concerned, the major issue is that the trainers at the DRG and BRG levels, district and block levels, are mostly the development partners, not the department people. This brings different approaches to the same module in different geographies. Lack of these government trainers actually reduces the ownership of government functionaries, which affect the quality and the monitoring of the training as well. uh, Infrastructure challenges are observed at the block levels. There are no designated training space for these training, which affect the quality of the training. ILA training talks about convergence and participation from all the line departments. We observed lack of participation of Department of Health and Family Welfare at the block and sector level trainings. Um, I will talk about a few findings from the quantitative survey that we conducted with Anganwadi workers across these 11 districts. Uh, Overall, 93% of the respondents reported receiving any ILA training. However, only 60% of these respondents recalled the names and the numbers of the last module they attended. This is where the trainers need to focus so that they understand what they're going for, what they're attending. Uh, though greater proportion of respondents who received trainings reported correct knowledge of whom to provide KMC, they were not able to correctly identify the correct way of providing KMC. The respondents who were trained had higher knowledge of when to initiate complementary feeding, The skill related to plotting for Sam and Ma'am kids, the growth on the growth chart, the respondent who received training were found better with better skill than respondent who didn't have received the training. The respondent who received training also correctly demonstrated all steps of hand washing, though the number was not that significant, but yeah, better than the people who didn't receive the trainings. Greater proportion of respondents who were trained demonstrated correct way of measurement of length and height. However, even among the trained respondent, a majority of them failed to demonstrate even a single correct step. All steps were correctly demonstrated only by 7% of trained respondents in case of height measurement and 3% of trained respondents in case of length measurement. As per the practice of these Anganwadi workers is concerned, they responded with trainings reported better planning and execution of their day-to-day activities and community-based events. Uh, we asked them about Anuprashan Divas and Bodh Bharai, and the respondent with training were found doing better with these two events. We also asked the respondent to show the household survey or if they have prepared any social maps, and the respondent with training had significant difference with respondent who did not. See, 91 and 2%, that was the kind of difference we found. Moving forward, if we have to, I have to summarize that how to sharpen these trainings, or how to make these trainings more effective, and how to target these issues. I would first of all, I'll say that ILA trainings have definite potential to significantly improve the performance of frontline workers. The Anganwadi workers were found receptive and keen to participate in these trainings due to relevance of the module in their day-to-day jobs. The challenge of poor quality of trainings could be tackled with effective utilization of allotted time of these trainings, especially at the sector level. Growth monitoring skills could be developed with regular hand-holding and a few refresher trainings. There is a need for mop-up round of training for left-out Anganwadi workers as well. The capacity of government trainers should be enhanced, and these trainers should be engaged in trainings. Training environment is compromised due to poor infrastructure at block level that affect the quality of training. The block offices should have designated training spaces with them. Participation of health department is observed to be limited so far. The ILA training requires and asks for a convergence between Department of Health and WCD. Uh, that's it. I will stop myself now. This is all about my presentation. I would like to thank the organizers for giving us the opportunity to present our findings. I welcome the questions.